So in this video we will learn about sideroblastic anemia. So what is sideroblastic anemia? It is a blood disorder where our body produces sufficient iron but it is unable to use it to make hemoglobin. So to understand it, we need to look at the biochemistry of heme synthesis. So what really happens, we have succinyl coenzyme A which forms ALA, which then forms porphobilinogen, which then forms protoporphyrin, and then with iron it finally forms heme with the help of enzyme ferrochelatase. Okay, so in this disorder what really happens, there is a defect in this enzymes, that is ALA synthase, ALA dehydrogenase and ferrochelatase. Okay, and which cause a morphology change in the RBC, making it microcytic, and also we see a hypochromic RBC. So in all it is a microcytic hypochromic anemia. Then we come to the causes of sideroblastic anemia. There are actually two causes, congenital and acquired. The congenital cause is because of enzyme deficiency, and whereas the acquired cause is because of three main reasons. We should see that the acquired cause is more common than the congenital one, and in that too the intake of alcohol is the most common one. So in acquired we have vitamin B6, deficiency of vitamin B6. This happens when we take drugs like isoniazid, which is used to cure TB. Then of course we have the most common cause, that is alcohol. What alcohol really do is it causes malfunction in mitochondria, and this all reaction uh, take place in the mitochondria. And then at last we have lead poisoning, which again causes damage in ALA dehydrogenase. So if mitochondria is damaged due to alcohol or lead poisoning, then the amount of hemoglobin will decrease. Why it will decrease? Because we know for a fact that amount of heme is getting affected. Okay, so also in the developing RBC we know that there is nucleus which is surrounded by mitochondria, and since iron is not getting utilized, it is getting accumulated in the mitochondria. So since it's getting accumulated there, we will have this type of structure of the developing RBC, this type of structure which is surrounded by iron, and this structure is called ringed sideroblast, which is it's one of the characteristic feature. And also the accumulation will lead to its leakage, and this will cause iron overload in the blood. And for the diagnostic purpose, we can see here that the serum ferritin level will increase, serum iron level will also increase because of iron overload, then percentage transferrin saturation will also increase, and finally the total iron binding capacity will decrease. We know when serum ferritin level increases, TIBC decreases, and vice versa. So that's it about sideroblastic anemia.